Hello, hi, this is Christine Crow here, and welcome to my channel. And today, what I want to say is thank you to all of you that have subscribed to the YouTube channel. I hope that you're finding this really helpful for you, and I just want to say thank you from the bottom of my heart again to just say let's just keep working together and learning about all the different things that we can be in terms of being the CEO, for example, some of the aspects of being a CEO, because it is quite a busy, vibrant life as well. And I understand that. So this is the reason why I'm doing these videos on a daily basis to get you prepared for 2025, and so that you're in a strong set, ready to go for the new year, for example. So let's get started. So today's video, I'm going to be talking about AI and business basics in healthcare, because I think it's something that we need to talk about and we can't avoid it any longer, for example. So are you a healthcare business owner feeling overwhelmed maybe? And you've got these repetitive tasks that you're having to do, administration work. Imagine freeing up your hours and your time by improving your accuracy and growing your business, all with the help of AI. So in this video, I'm going to be talking to you about how AI can get you started with the AI tools and the business basics to streamline your healthcare business. Now we've got the mini bootcamp, which starts on the 27th and the 28th. It's a free mini bootcamp, but the business recovery bootcamp starts in January the 7th, 8th and 9th. And I just really want to get you prepared for, the new year, for example, and what we really need to be focusing on in order to become the best of the best of the best and be world class at what we do. So I'm just going to go through a few things here with you that you need to be thinking about. So I hope that you got a pen and paper ready and that you're here to, make some notes. I know you can watch the video back again, but it's always good to do that. But before we continue, I would love for you to subscribe to this channel, and it will help you to learn about some strategies on growing your healthcare business as well. So why does AI matter in healthcare? Artificial intelligence isn't just for tech giants, it's transforming healthcare. You've seen it, they're talking about it all the time. It's in the budget in the UK, for example. They want to help with increasing telehealth care, for example. But as business owners like you, whether you run a home care agency, recruitment business, a private agency, for example, nursing agency, private hospital, for example, as well as the NHS hospitals, government hospitals, wherever you are around the world, it is here and it's here to stay, and there's no avoiding it. So we really got to get with it now to be really ready for 2025. So AI, what can it help you with? So it can help you with some automated administrative tasks like scheduling, documentation, follow-up, all the things really that you find repetitive. It can assist you in that as well, which I think is a good thing as well. As a CEO, it's good to have as many things as possible that's going to be quick. Look, I'll be the first one to say I do use AI in my business, because I know when I do something, it gets done straight away. I'm not having to wait 3, 4, 5 days for things to be done, for example. So, like I said, it can help you with follow-ups. It can enhance your customer service. So there's chatbots as well as virtual assistants. They can handle your 24/7 things as well. The chatbots are really good with communicating on Facebook. You got your Facebook. You haven't got time to be answering different questions. If you've got a chatbot, then the chatbots will act immediately. They will do the message according to what you've programmed in that chatbot, but also it will act on anything as well to help your business to flow for customer service as well. So you're not waiting for someone to come on line at 9 a.m. Someone's got a problem in the middle of the night. It can be dealt with in the middle of the night to help alleviate that person's worries, that customer's worries. So I agree with that on that because it is brilliant. Okay, so these are all things that I'm actually introducing as well. So I'm not going to talk about something to you and introduce it to you if it's not something that I'm not using currently at the moment. And I've started using it from really about August this year as well, because I've been seeing how it works behind the scenes so that I know what I'm dealing with and who I'm going to be offering this to as well. So like I said, the chatbots are really good. It can answer questions for you without having to wait till someone comes on duty, for example. It really does help in that way. It can improve your data accuracy as well. So the AI tool can analyze data and reduce human error as well, which I think is really good. There's also, for example, when you look at all the different essential AI tools to get you started, there's the things like Chat GPT, which is, we all know that now. We're all fired up about it. And, I'm going to talk about that first because everybody knows what that is. Well, you should do, but however, I'm going to go into this anyway. So the AI tool can help draft patient communication, respond to inquiries, or even write a blog post for your website. It can even do websites for you. It is remarkable. It really is. So I'll give you an example. When you need to follow up on an email, you just input it into the Chat GPT and then it will follow up on the email and it can generate a professional email in seconds. I am beta testing all of these things so that you can use this, and this is what I'm going to be going through in the Business Recovery Bootcamp, because it's something that we need to start looking at. Because if we're looking at reducing our staff members, look, I'm not going to show you things that I'm not doing myself. If we're looking at reducing staff members, then we need to have things in place that's going to make our lives more easier. And I'm saying that, I'm going to say it again, more easier. That's what we want for 2025. Another one for your automation is Zapier. Okay, Zapier is an automatic tool that can connect your app. For example, when you've got a new client, it fills out a form on your website. Zapier is automatic. It adds them to the CRM that you've got. It sends them a welcome email and it schedules a follow-up call. These are all things that I'm implementing right now so that I can really say to you, yeah, this really works really well. And it does. Okay, so visual workflow diagrams as well. That's what it will help you to do. There's also Calendly scheduling. This is a scheduler tool that schedules appointments, for example, books appointments directly based on the availability that you have. So no more back and forth emails. You know, it's like, are you available on this day? No, I'm not available on this day. I'm available at this time. Oh, sorry, I can't do this time. It straight away goes in and does it automatically. It can even make phone calls. Yes, it can even do sales calls, but that is another session for another day. So integrate Calendly with your virtual assistant if you have one, or you can use it as well to ensure the appointments are followed up effectively. So how do you implement AI into your healthcare business? So you identify what is your repetitive task. What are the things that you're doing repeatedly, like scheduling, like data entry, like sending reminders, for example. Choose the right AI tool that's suitable for you. Match these tasks with the AI tools that I've discussed. For example, ChatGPT, writing task, Zapier for automatic workflows, Calendly for scheduling, for example. And then what you want to do is you want to start small and then you can scale. Begin with one process at a time. For instance, automate your client's onboarding process. Once that's running smoothly, then expand into the other areas. Let me share with you one example to streamline your AI, for example. Like, I do meetings on Teams, for example. I do meetings on Teams daily with my clients. So what I do there is that I record the conversations that we have together, rather than me typing or having to have an assistant to type up the notes whilst I'm in a meeting. So what's really good here is that the AI will be typing up the notes so that after the meeting, what happens there is the video gets sent as well as the meeting notes get done, and then it then gets emailed to the client, for example. And this is all done by the AI tool that we have, for example. It is a no-brainer. It really is. It helps you. Okay? So imagine that. Something which I used to, when I had my VAs and they'd be making notes, my executive assistants, they'd be making notes, and it would take them like 3 days, 4 days to send the meeting notes. By that time, the next meeting is ready and scheduled, for example, but the client hasn't had time to really read through the notes and the meeting notes, the things that they need to do, as well as the things that we need to do as well, for example. So it is really a good idea. So AI, it's not the future, it's here, it's the present. So by leveraging these tools, you can reduce stress, you can improve your efficiency and grow your healthcare business faster than ever. Seriously, it's like a speed of light. If you want more strategies about using AI and growing your healthcare business, I'd love for you to hit subscribe and turn on the notification button here. Drop me a comment below. And if you have any questions about AI, I'd love to help. So please do book a free 15-minute appointment so that I can go through this with you, some of the strategies. But join our 2-day mini boot camp. But I'd love for you to join our real boot camp, which starts in January, because I'm going to be covering all of this and showing you the real action and how it works and how it will free up your time. It seriously will. So another thing I want to mention to you is telehealth robots in healthcare. Look, I mentioned the other day, and I'm going to grab my tea because I need to have a quick sip of my tea. So imagine you walk into a hospital, and this was in America when I was visiting my twin brother, and I mentioned about the robot. Well, there was a robot that was, because my brother was at Disney when he had his heart attack, and he was in this hospital in Disney, and this robot came up to him, for example, was doing, all of the stats, for example, which is great and wonderful because it will relieve the staff members that are working really hard. I understand that, and I'm trying to get my head round it, although when I was seeing it, it was, for me, it wasn't the right time for me to embrace it. I was possibly seeing it in a negative light, and I'd like to revisit that because there has been some improvements now that I've seen at these hospitals, for example. So I'm going to talk in a positive way about telehealth care robots, how it can help the nurses as well as the healthcare workers, for example, so that they can do their job effectively, which is the patient care, which is important. Okay, so one of the most exciting advancements in healthcare is AI and the use of telehealth robots. For example, there's a company called Ava Robotics, which is telepresence robots, which is what they're calling it now, are helping doctors treat patients whilst minimizing infection risk. And I understand that part, that is where it would be a good advantage, for example, because something that can become incredibly valuable, especially during when it was the pandemic, it was very helpful then. So let me talk about how it works. These robots allow doctors and nurses to work remotely, visiting patients, monitor their conditions, and even provide consultation, all while staying safe and also efficient as well. And the benefits are that the safety, it reduces the risk of infection for healthcare workers, which I do believe is important. So the efficiency is that it enables doctors to see more patients in less time. Accessibility, it brings healthcare to remote or understand the underserved areas as well in these locations. So an example would be, imagine that there's a doctor consulting with a patient in multiple rooms or even different hospitals without physically being there. Now that is definitely a benefit, okay? Telehealth robots make this possible, and improving patient care and streamlining the hospital's workflows, because I really want to be able to say I want to help by talking about this, not in a negative way but in a positive way, so that it can help the hospital staff that are under a lot of pressure. So this is why I'm revisiting this, because I've done my research as well. So, and I'm also looking at it from a third person, not from a relative point of view as well. So have you ever seen a telehealth robot in action? If you have, drop me a comment. What did you think about the technology? Do you think it could actually transform healthcare? I want you to be able to really think about this and look at how this can benefit, because there's a lot of transformation happening, and we really do have to learn how to embrace this for the positive if you are working in the healthcare sector. So these robots in healthcare can vary, and it really depends on the type of healthcare technology niche that's generally attracting a different type of service to be specialized, basically, in the professional audiences, that healthcare professional audience that use it, that they engage with it. So we've got to look at these factors as well. So also the demographic areas, the locations, hard to reach locations is really good. It helps with the doctors that can't be in that location. So I've had a change of heart, and I'm looking at this in a more positive light than what it was for me, a couple of months ago, for example. Okay, it is in high demand now. Okay, and these medical devices companies, these tech firms, these educational institutes are really pushing for it as well. So I wanted to really just touch briefly on this today to encourage you to just, look at it, embrace it. If you want to be part of the new type of healthcare agency, healthcare business model, you've got to embrace this, and you've got to become a part of it as well and work with it as well. So I hope that was helpful to you, but I wanted to bring in AI and healthcare robots into what we do, because at the end of the day, telehealthcare and AI and robots is now part of healthcare. I never thought I'd be saying this, but it is, and we have to embrace it and see the positives from this. So, like I said, AI, robots in healthcare, the future is here, and it's here now. So we have to embrace it. So I hope that you've enjoyed what I've spoken about today, and I want you to start thinking about this. I am going to be going live tonight, and I will be doing another video, and there'll be some more videos being uploaded on here, because I want to try and give you a variation of you being the CEO in healthcare, the things that you need to think about as the CEO, as well as trying to cover your whole needs, your holistic needs, as well as your health and wellness as well. And to also look at what are your plans for your future as well. And that's why you'll see some of the things that I talk about, the day in life as a CEO in healthcare, because at the end of the day, we've got to look at where we are now, but we've also got to look at the future and who we are wanting to be in that future. We need to start working towards that now so that we can meet that future self. So I hope that was helpful for you. I hope you've enjoyed today's training and discussion, and I will see you on the internet. Do join me live tonight, and that's going to be 7 p.m. UK time, and I look forward to discussing that with you. And have a wonderful, blessed day, everyone. Thank you so much. Take care. Goodbye.